Today, we are diving deep into substance use disorder. And we're not just going to skim the surface. We're going to go past the headlines and really look at the clinical side of things and the very human journey from crisis to care. So let's just start with the biggest question of all, right? Where is that line? At what point does using a substance stop being a choice and start becoming a real problem, a disorder? That's really the question at the heart of everything we're talking about today. To even begin to answer that, we have to change how we think about the problem itself. The whole medical community has had this huge shift in understanding addiction, moving away from these old, really rigid labels. Okay, now look at the words here. This is so important. The clinical definition calls addiction a chronic brain disease. It's not about being a bad person. It's not a lack of willpower. It's a disease. That one idea completely changes the conversation from blame to biology. It's a massive shift. And that shift is really captured here. We used to think in these black and white terms. You either abused a substance or you were dependent. That's gone. Now clinicians see it as a spectrum, a gradient that goes from mild all the way to severe. And that allows for care that's so much more nuanced and frankly personal. So let's circle back to our original question. When does it become a problem? Well, in broad strokes, you cross the line when the substance starts to take apart your life, when it gets in the way of your job or school or your relationships, when you keep using it even when all these negative things keep happening. And, this is a big one, when it starts to harm the people you care about. But here's the thing. Addiction almost never happens in a vacuum. It's not that simple. To really get it, you have to look at this tangled web it creates with relationships and often with other mental health conditions. This image, as simple as it is, just nails it. You can see these two cycles, addiction and codependency, just feeding each other. They lock into this closed loop that is so hard for anyone caught inside to break out of by themselves. So what even is codependency? Well, it's a tricky situation where trying to help actually ends up hurting. Someone who loves the person with the best intentions in the world ends up enabling the addiction. They make excuses for them, they pay their bills, they clean up their messes, and in doing so, they're accidentally shielding them from the very consequences that might push them to get help. And the other piece of this web is something called a dual diagnosis. This is super common. It's when someone has a substance use disorder and another mental health condition, like depression or anxiety or PTSD. And what happens is the substance becomes a way to self-medicate, a way to try and cope with the symptoms of that other illness. It's a temporary fix that, well, it ultimately makes everything worse. Now, to really understand just how physical this disease is, we're going to shift gears. Let's move away from the theory and look at a real-world case study. We're going to see what happens when the body has become dependent on something, and then, suddenly, it's taken away. Okay, so let's meet Sam. His brother brings him to the ER, and this is the state he's in. He's confused, he's shaking, he's fading in and out, and he's having these awful hallucinations about bugs on his skin. His body is in total crisis. The question is, why? What Sam is going through are the textbook and very severe signs of alcohol withdrawal. His blood pressure is through the roof, he's got the shakes, the anxiety, and of course, those terrifying hallucinations. This is not just in his head, it's a full-body physiological rebellion. And the scary part is how fast this all happens. Look at this timeline. The first symptoms can start just 4 hours after the last drink. Within a day or two, the risk of life-threatening seizures skyrockets. And then you hit that 48 to 72-hour mark, and that's when you enter the real danger zone. And that danger zone has a name, delirium tremens. You might have heard it called the DTs. And the use of this particular beer bottle in the image is, well, it's a pretty grim coincidence, isn't it? This is the absolute most severe and life-threatening stage of alcohol withdrawal. This is exactly what is happening to Sam. His diagnosis is alcohol withdrawal delirium. He's experiencing that rapid, intense confusion, a total break from reality. Make no mistake, this is a full-blown medical emergency. So when a patient is in a crisis like this, how do doctors and nurses even respond? How do you pull someone back from that edge? Well, it's not guesswork. It's actually a very careful, very methodical process. So in such a chaotic situation, care has to be standardized, and clinicians have a tool for this. It's called the Clinical Institute Withdrawal Assessment of Alcohol Scale, or just CIWA for short. It's basically a scoring system that lets them objectively measure how severe a patient's symptoms are moment to moment. And that score tells them exactly what to do next. This table is a simplified look at how it works with a medication called lorazepam. You can see it pretty clearly. The higher the CWA score, meaning the worse the symptoms, the higher the dose of medication. It's a responsive, data-driven way to keep the patient safe.
That medication is just one piece of the puzzle, though. They use CNS depressants like lorazepam to calm down the entire nervous system, which is an overdrive. They use anticonvulsants to prevent those deadly seizures. And they pump the body full of things like thiamine and electrolytes because chronic alcohol use just strips the body of all its essential nutrients.
But it's so important to remember that getting someone through the acute withdrawal, that's just step one. It's just stabilizing the crisis. The real road back is long. True, lasting recovery is a slow process that takes everything: therapy, 12-step programs, ongoing medical support, you name it. And that kind of brings us full circle. We've gone from what addiction even is, to the terrifying reality of withdrawal, and finally, to the careful path to recovery. It shows that getting from crisis to care isn't just about medicine. It's about empathy and understanding. So I'll leave you with a question to think about. How does the way we see substance use portrayed in movies, TV, and music affect our real-world perceptions of it?